Does the type of graft that you use for an ACL repair matter? Um, I think overall, no. There, sure, there's a lot of evidence about whether a quads tendon now or a patella tendon are stronger than a hamstring tendon graft. Uh, Although in my line of work, I always still come back to the fact that the majority of those studies aren't done on elite athletes, or certainly not elite rugby league players. So I think you have to asterisk the choice there. I personally prefer dealing with a hamstring graft because I think you don't deal with the anterior knee pain and the soreness around the graft site, um, which effectively becomes like dealing with a patella tendinopathy, and dealing with any tendinopathy takes a lot of time. So I think that slows down the potential to return at a quicker rate. But overall, the things that matter as far as the risk factors for tearing your ACL, um, strength, single leg stability, proprioception, deceleration skill, jumping and landing mechanics, the type of grass people are on, footwear and the configuration of their studs, previous injury history, all that sort of stuff, being a girl and having a wider hips with a greater Q angle. All of those factors have nothing to do with the graft type. So if we're going to reduce the recurrence of, or the risk of doing your ACL again, then you want to deal with all of those factors. And you're going to do that, or you should do that, regardless of what graft you've had. So in my mind, then, if they're the things that you're going to take care of to try and stop the person from tearing their ACL again, well, then it doesn't matter what sort of graft they've had, because unless you take care of those things, they're going to tear their ACL. A quad tendon graft or LARS or whatever, they aren't so strong that if you haven't addressed the person's ability to change direction and maintain a co-contraction of the quads and the hamstrings and position of the pelvis and everything like that at high speed, well, it doesn't matter what graft they have, they're going to tear their ACL again. So yeah, it was something I saw the other day and I thought was a good topic for a post. I think it's an interesting discussion. Obviously, a lot of surgeons would think that the type of graft does matter, and in a sense, there is research supporting different types of grafts versus the others. But as I say, I think the things that cause someone to tear their ACL are the things that you've got to manage to stop them from doing it again, and none of those really relate to the type of the graft. So that's my 2 cents. Until next time.